Hi, this is David Parra with AARP, Arizona Hispanic Connection, and we are doing an update. We have this kind of updates every once in a while. We used to have them every week, but now we're just going to have them when we have something very worthwhile to let the community know. And today I am with Matt Jewett. Matt Jewett is the Director of Health Policy with the Children's Action Alliance. Matt, welcome to our update today.
Thanks, David. It's good to be with you again.
Perfect. I wanted to ask you this because as someone who does this kinds of, informational shows, issue based, this Kids Care change kind of caught me off guard. Where did it come from? When
Yeah,
did it
so
start?
here, right, last year in the state budget, Governor Hobbs fought for and the legislature passed as part of the state budget that was agreed to an expansion of KidsCare, which KidsCare has been covering kids in Arizona since the late 1990s, so for about 25 years. And it's basically the program within Access that covers children whose families make too much for traditional access Medicaid, but who still don't have health insurance. And it
So,
did take us a little bit of time for the federal government to approve this because it's a joint federal state program.
there's a word that comes to mind and that I hear it very much linked to access, and it's called demonstrations. What are those?
So, Access is a demonstration project. It basically everything that Access does has to be reapproved by the federal government every few years because it is an innovative program. It uses managed care organizations, so health plans that you might have heard of. That sometimes people will say, "Oh, I have Mercy Care" or something like that, and that is an example of one of the Access health plans.
Good. So, in very, very brief, Kids Care is very much like Access,
Yeah,
but it allows you to make more money, and
right.
then you end up paying a small premium. Is that a good
Right.
summary of the difference between the two programs?
Yes, it is. So basically, we took Access and we expanded it years ago to kids who are making twice the federal poverty level because we realized that kids are one of the least expensive groups to insure, but also one of the most important because they require a lot of well child checkups, and we have a lot of opportunities to get things right in childhood and prevent future health issues, and we won't have that opportunity again. And we want our kids to grow up healthy so that they can go to school and really thrive in school and in life.
Can you tell us about the numbers of children that could be helped, the
Mhm.
uninsured, so we can have a picture of the meaning of this important change here for us in Arizona?
Yeah, so this the graph that's up right now shows the bottom line is the national rate, and the top line is the Arizona rate of kids who have no health insurance in our
Hmm.
state. And you can see that both on the national and at the state level, it has come down considerably. Some of that's the Affordable Care Act, healthcare.gov, the healthcare marketplaces, but also expansion of Medicaid, which in Arizona is Access, and CHIP, Kids Care as we call it. And that should come down even more. You'll see that in the mid to late 2010s, there was an increase in uninsured kids because we actually froze Kids Care before in our state and didn't allow kids to get into it. And when that happened, more kids were without health insurance.
Hmm.
So we expect about 10,000 more kids are going to become eligible for Kids Care for low cost health insurance because of this expansion.
There is an item here that I believe I need to mention it. That's because as AARP, we are we focus our efforts on the 50 plus. And we know that we have a large,
Yeah.
I want to say thousands of grandparents raising grandchildren who are definitely going to
Yes.
be part of a segment that is going to benefit a lot from this change. Any light on that?
Yeah, we talk a lot with caregivers who are not parents, they are grandparents.
Mm.
And especially in some of those communities who are at the top of this slide, that's not uncommon in Native American and Black African American families in Arizona to have multi generational families and caregivers. And I think those are some who will benefit the most because they have among the highest rates of uninsured children. And while it's come down significantly in Arizona and nationally, we know some groups have much higher rates. Also, if grandparents have guardianship, sometimes children are kind of considered a household of one, and they may qualify on their own for traditional access Medicaid if the family has a legal guardianship of a grandchild, for example.
Now you are with the Children, hello, Children
Yeah.
Action Alliance. You're the director of health policy. You must feel good to see this change that allows now a family to make literally 25% more than what they used to be allowed before. How do you feel on a personal level being a health policy director?
David, our organization was down at the Capitol more than 25 years ago fighting to create this program.
Mm,
And we've also been through its ups and downs. We remember when our state became the only state in the country that was not enrolling kids into KidsCare. And, we dropped from 60,000 kids being covered in KidsCare to less than 1,000. And
mm.
we fought to bring it back in 2015, 2016. And we've been fighting to increase the income eligibility so more moderate income, middle income parents can get the affordable care they need. And this is like access, it has all these child specific coverage. For example, it covers everything that's recommended by the American Academy of Pediatrics as far as well visits. And it is not just medical visits, it is behavioral health, it is dental, it is vision coverage
Mm.
all in one. So that's extremely exciting because it gives kids what they need to grow up healthy and thrive.
And dental is a very important piece of our healthcare for children specifically, right?
Yes, because that's another thing you want to get right early on.
Yes, yes. It's interesting. Okay, so looking at this slide, we see I'm sorry, American Indian, Alaskan Native, we have 14% uninsured.
Yeah.
Black African American is 12%. This is of children, correct?
Yes, children in Arizona.
And then Hispanic, we're talking about 10% of children are
Yeah.
uninsured in Arizona. Then
Right.
Asian, Native, Hawaiian, Pacific Islanders, we're talking about 9%, and then whites are at 6%, correct?
Right. That's right. And the interesting thing for that top group, American Indian and Alaska Native, so there is a monthly premium with KidsCare because the income is a little bit higher than traditional access, but it's still very low. It's $10 a month up to $50 a month for one child. And it's a little bit higher if you have two or more children. It can go as high as $70 a month. But families don't pay anything when they go to the doctor. And the other thing is that enrolled tribal members and their children and grandchildren are exempt from those premiums. So we're
Mm.
really trying to get that word out for that American Indian and Alaska Native population for whom there are still high rates of uninsured kids.
Yeah. So I asked you in our conversation prior to this update, Matt, to also include the 200% so that we get
Yeah.
an idea what how income looks like. So let's just take an example of four, a household of four. And let's just look at the traditional family, if you will, a couple with two children. You're looking at that if they used to make 73,000, now they can make 84,000 and still be eligible.
Yeah, I think that's actually for a family of five, if I'm reading it right. But
I
yes,
apologize. You are
it's
correct. From 62 to
yeah.
71. Yes.
So so that's the increase in the income limit, the old kids care limit versus the new kids care limit. So
Mm.
basically, it's about an extra $9,000 to $10,000 a year that
Wow.
families can make. So more families are going to be eligible.
This is great. Now I don't know if you already mentioned it or it was off the air that you told me that a kid who is currently insured They
Yeah.
cannot just, because it's quote unquote cheaper with the kids care, they
Yeah.
cannot drop their coverage and come to get the kids care. Is that correct?
Right. So it's not meant for people who just have, more expensive health insurance at work. But at this income level, a lot of people don't have health insurance through
Hmm.
work. Um, and so it's more for uninsured kids. But if a child is losing their health insurance, for example, if a mom or dad lose their job, they don't have to wait 90 days or anything. There are exceptions. So we encourage people to apply, and one of the best ways is to visit the website coveraz.org, which is where people can find help in their communities. There are 200 plus community organizations around Arizona that can help, and they can schedule an appointment at that coveraz.org website.
You know, I should have made a banner for that. I'm
Yeah.
looking at my banners here. I don't believe I see it, or probably somewhere hidden somewhere, because I know I used it a lot. Cover Arizona or Cover AZ?
Cover AZ, coveraz.org.
coveraz.org, and I promote that site a lot, because all they have to do is literally to plug in their zip code, and they are given all kinds of
Yeah.
organizations that help free of charge to apply for these benefits. Correct?
Yes, absolutely. And people can also call 211, and they will be connected as well to someone in their area. But you can literally make the appointment on that website, coveraz.org.
I believe this is sufficient, Matt. Unless you have anything else that we didn't cover that you would like to mention in this update.
No, I think that's it, David. I appreciate you having me on.
All right. Well, thank you. We just had Matt Jewett from Children's Action Alliance. He's the Director of Health Policy with Children's Action Alliance. We thank him for giving us this update on a very, very good news for Arizona. The Kids Care income threshold has been moved from 200 to 225% of federal poverty level, and this is supposed to help around 10,000 kids. Again, Matt, thank you so much, and we hope to have you at a different time and on another topic.
Thanks so much, David.
All right, bye-bye.
Bye bye.